Hello, today I'm going to talk about the history of public health care in Malaysia. But before I begin, I would like to acknowledge the following people who have contributed materials and slides to this presentation. Public health care will be discussed here in the context of healthcare provided by the public sector. Healthcare provided by the private sector will be referred to as private healthcare. Not much is known about the history of healthcare in Malaya before. Early healthcare was virtually unknown. Early healthcare provision in Malaya concentrated around Malay traditional medicine, which was a blend of folklore, Hindu mythology, Muslim orthodoxy, and Arab pharmacopoeia. The history of Malaya is very short. In 1400, Parameswara, who hailed from the kingdom of Majapahit, established the Melaka Sultanate. This lasted for a little over 100 years. In August 1511, Alfonso de Albuquerque, a Portuguese from Portugal, captured Malacca. The captain of Malacca at that time was Rai de Brito Patalin. He built the fort A Famosa over a period of 3 years. He also built 2 hospitals, the Hospital del Rey, or otherwise known as the Royal Hospital, and the Hospital de Pobres, or otherwise known as the Poor Hospital, which were managed by the Jesuit priests. In 1545, St. Francis Xavier arrived in Malacca. The rule of the Portuguese did not last very long. In 1641, the Dutch captured Malacca. The governor of Malacca at that time was Balthasar Bot. He established a surgery clinic which was headed by M. William Cornelius van Alsemere. He also built a hospital for Dutch citizens. The staff at that time consisted of a senior surgeon and 4 junior surgeons. In the 1800s, in 1786, the British settled in Penang. And in 1795, the British captured Malacca from the Dutch. In 1819, the British purchased Singapore from the local ruler at that time. The British then built garrisons with hospitals or infirmaries for care of European officials and families. In 1880, Chinese settlers in Kuala Lumpur built a hospital for workers. It had 28 beds. In 1882, the British built a public hospital in Malacca. It had 3 wards. In 1883 to 1910, general hospitals were established in all state capitals by the British. That wraps up our section on the history of early healthcare in Malaya. Next, we will be talking about modern public healthcare in Malaysia.